We recently published our research on hypertensive disorders of pregnancy and maternal cardiovascular disease risk factor development in Annals of Internal Medicine. Preeclampsia and gestational hypertension are common pregnancy complications involving high blood pressure that arises for the first time during pregnancy and returns to normal shortly following delivery. Previous research has shown that women with a history of either of these hypertensive disorders of pregnancy have an increased risk of cardiovascular disease later in life, events such as heart attack and stroke, when compared to women who had normal blood pressure during pregnancy. These relationships have been consistently observed in different populations and studies, such that both the American Heart and Stroke Associations recognize preeclampsia and gestational hypertension as risk factors for cardiovascular disease in women. What remains less clear at this time is how do they get there? More specifically, what cardiovascular disease risk factors do they develop between the pregnancy and the cardiovascular disease events, and when do they develop them? It was only about 10 years ago that the relationship between preeclampsia and cardiovascular disease was first summarized in a meta-analysis. That's because it took nationwide registry-based studies from countries like Norway and Sweden to be able to connect the dots between pregnancy exposures like preeclampsia and cardiovascular disease events taking place decades later in time. It's also because much of healthcare provision and the pursuit of research has traditionally taken place within silos in specialties like obstetrics and gynecology and cardiology. It's also hard to find data sources with sufficient information on both a woman's pregnancy history and long enough follow-up to capture cardiovascular disease events later in life. While more attention has been given to this area of research recently, and obstetricians, gynecologists, and cardiologists are increasingly aware of the relationship between hypertensive disorders of pregnancy and cardiovascular disease, we felt it important to bring these findings to the readership of Annals of Internal Medicine. Doctors who see and treat women after pregnancy and through older age need to know that women with a history of gestational hypertension or preeclampsia have an increased risk for developing cardiovascular disease risk factors. They also need to know that this risk emerges shortly after pregnancy and persists across decades. In our study, we found that women with a history of preeclampsia or gestational hypertension had an increased risk for developing chronic hypertension, type 2 diabetes, and elevated cholesterol after pregnancy. We also found that those relationships persisted even after adjustment for pre-pregnancy information, like body mass index, smoking, and family history. Specifically, we saw that women with preeclampsia or gestational hypertension in first pregnancy had a 2 to 3-fold increased rate of developing chronic hypertension, a 70% increased rate of developing type 2 diabetes, and a 30% increased rate of developing elevated cholesterol after pregnancy compared to women with normal blood pressure in pregnancy. We also found that these women developed these cardiovascular disease risk factors sooner after pregnancy than women with normal blood pressure in pregnancy. As recommended by the American Heart Association, doctors should be sure to take a detailed pregnancy history of their patients, being sure to capture any history of preeclampsia or gestational hypertension. Women who have had preeclampsia or gestational hypertension should tell their doctors and adopt a heart-healthy diet and lifestyle, just as they would if they had a family history of cardiovascular disease.